Hello everyone, this is Dr.RUkmani Choudhary and my today's topic is transverse myelitis. So in today's video, I'll be talking about what is transverse myelitis, causes, diagnosis, best effective homeopathy medicine, allopathic mode of treatments. You are requested to watch complete video for complete information, and if you're watching first time, please like, share and subscribe my channel. Press the bell icon to get notified. Let's begin. Transverse myelitis. Let's talk about myelitis first. Myelitis, word comes from myelin, sheath, and myelin is the sheath that protects your nerve. That is an insulating kind of thing that protects and that covers your nerve, and that transmit signal from the brain to the body part. So that's how we respond. Any reason after an infection, any injury, if this myelin sheaths gets damaged and it is inflamed, there is a swelling of myelin sheath, then it is called myelitis. And if it is on the both side of the spinal cord, then it is called transverse myelitis. So this is a neurological condition in which you have damaged myelin sheath. Right, then why you have this problem and what are the causes, what conditions can cause transverse myelitis? Let's brief about some immunological disorder. Our immune system obviously for the fighting purpose, but at times the body destroy itself, its healthy tissue, then this is called autoimmune disorder. So one of the condition autoimmune disorder, lupus, that also causes this problem. There is no direct cause, but these are certain believed theories, certain risk factors that can cause this condition. Moving ahead, there are certain types of infection. After those infection, you develop these symptoms of transverse myelitis. These infections can be bacterial, viral, fungal. In bacterial, you have tuberculosis, you have syphilis, after syphilis and Lyme disease. And in viral infection, you have a varicella zoster virus or shingles or enterovirus. These virus post-infection also causes this condition. And fungal infection, so certain kind of fungi like you are having cryptococcus or aspergillus fungus can cause this condition. And parasitic infection like infection, or either after having certain immune disorder or after these infection this condition, that is transverse myelitis. So moving ahead with the symptom part, symptom can be this can appear even within hours or days, sometimes it takes 10 days. So in this case, this is acute one, means you are having symptom within hour or within days. And the second category is subacute, in which you develop symptom in some month. So these are the two categories, acute or subacute. Symptom always depend that how much your spinal cord is affected, what part is affected. The more the damage, the more symptom you have, the worse symptom you have. Because this is a neurological condition, so you have nerve related symptom, like you may have paralysis, you may have certain loss of control, like you have loss of appetite, you have loss of urinary control, so you have involuntary urination, you have needle or pins or needle sensation, you have numbness, you have tingling sensation, and at times there is a sharp shooting pain, electrical shock like pain you have. So these are the symptoms you may develop, or it depends whether it is due to any infection, then you may have vomiting, fever, and neck pain, sharp shooting pain, stiffness. Now the diagnosis part. Diagnosis is mainly done by MRI and CT scan. MRI almost demonstrate your damage of the myelin sheath. So MRI helps a lot, and CT scan, and at times there is a spinal tap. Spinal tap is done. Spinal tap is collecting fluid from your intervertebral space. The space between your vertebrae, there is a fluid, so that fluid is taken out, and that is studied for the type of infection. Usually in infection you have high WBC count, means your white blood cells are obviously raised in your any kind of infection, so the fluid is taken and studied further for evaluation purpose that what type of infection you are having, and your allopathic mode of treatment depends on the type of infection you have. The allopathic mode of treatment, as you are having inflammation, myelitis, so there is a swelling. So for ease that swelling, you are given steroids and you are given IVIG, means intravenous like antibodies. You are prepared antibodies is given. Why? Because your immune system is mistakenly attacking its own tissues and like making unhealthy antibodies. So for replacing those unhealthy antibodies and for removing those unhealthy antibodies, prepared antibodies are provided, and they combine with unhealthy antibodies and they remove ultimately. So this is how it works. And plasmapheresis. Plasma is a liquid of your blood, liquid part of your blood that has RBCs, red blood cells, and the liquid part is replaced. So this is called plasmapheresis, means your plasma is there are certain, even there are physiotherapies, there are occupational therapy. Being ahead, the best effective homeopathy medicine or top medicine we can say, or the most working medicine we can say. See, in homeopathy, your totality of symptom, collection of all your symptom is most important. So this is like kind of totality of symptom, like holistic approach. So we have certain medicine, but these are not the limited one. There are other medicine as well, and it completely depends on the patient's history, past medical history, present medical history, what all symptom you are having. And if you're watching on YouTube, all these links are given in description box below. You can buy medicine, but according to your case. And see, the form of medicine can differ, the company may differ. Just try to buy authentic company medicine in lesser quantity, so that you, whenever you want to change and there is no improvement, there is a scope that you can change your medicine. Is the tops the chart. This is very effective in all kind of nerve injury or neurological cases. Hypericum works amazing when you have there's a sharp shooting pain and you have stiff neck and there's a numbness. So in that case, you can use hypericum. This is in the tablet form. You can even like buy the liquid form of the medicine. If it is in the liquid, just have 1 or 2 drops. If it is in the tablet, like you have 2 to 3 tablets in a day before having meal. So this medicine, Restox is given when you have like stiffness and you are aggravated while the cold weather, rainy weather, and there's a stiffness, and your symptoms are better while applying warm compression, and while exercising or while being active, your symptoms are better. So in that case, you can take Restox. This is in the liquid dilution form. Take with the help of dropper, just 1 or 2 drops directly on tongue. If any problem, just add some water. Right. You have burning along your spine, means you're having burning sensation, you're feeling weakness. So there's a weakness, burning. In that case, you can use Zincum metallicum, again with the help of dropout. Is the leading remedy in homeopathy. Any kind of injury, any kind of neurological disorder, causticum works amazing. So in those cases, like if you are having any loss of control, like loss of urinary, involuntary urination, there is Alifos, again very good medicine in all tiredness cases, weakness cases, like you are having weakness, fatigue, tired, and especially lower limbs, means your legs are affected. In that case, you can take Califos. This is again in the tablet form. So just have 2 tablets twice or thrice before having meal or after like having 30 minutes of. The bigger tablets can be taken directly. If you are comfortable, you can swallow all these pills, and if you're not comfortable, just add some water. 1 spoon of water is enough. Just dissolve the medicine. Drowsiness, dizziness, dullness, and like paralysis. So in all these cases, you can use gelsemium, 1 or 2 drops twice or thrice. Dr.RUkmani German homeopathy medicine. This is like multi-purpose. All sort of injury, whether this is a muscular injury and after a spinal injury, nerve injury. So this is very effective, again in the drop form. So just have 5, 10, 15 drops in some water and just have like twice or thrice before having meal. The medicine as well, depending on individual patient's case history. So hopefully this video can help you. If you find this video knowledgeable, informative, please like, share, subscribe my channel, press the bell icon to get notified. Thank you so much for your time. Keep watching, keep supporting.